just graduated law school and landed a great job at an up-and-coming firm. I can't have a child now, but someday I want to. But I don't want that someday to be too late.
I was married once. I date, but I still haven't found the one. I may never find the one. That shouldn't mean that I can't be a mom when it does happen, or even if it never does.
I have breast cancer. My oncologist said that the chemo might make me sterile. I can't believe a child won't be part of my plan.
Hello and welcome. My name is Lauren Herring. I'm the Director of Nursing and Practice Manager at the Genetics and IVF Institute. We are here to give you more information so you can decide if personal egg banking is the right choice for you. Personal egg banking is a decision that many women are faced with, yet few are aware that they have. There are a variety of reasons that someone would choose to delay their biological clock, including taking the time to further their career or finding the right partner in life. In the case of somebody who's a lawyer, they may be newly graduated from law school and they want to take the time to work their way up the corporate ladder before they feel that they're ready to actually have their own family. Another benefit of personal egg banking is for those out there in the dating world to allow them the freedom to take the time they need to make the right decision to find their life partner versus rushing into a decision that may not end up in the best outcome. For those women who are unfortunately facing certain types of cancer or diseases that their treatment might make them infertile, fertility preservation by banking eggs is a really great bonus for them to think about using so that they can focus on going through their treatment, and once everything is complete, then they can come back and think about trying to have a biological child of their own someday. Here at Genetics and IVF Institute, we've been helping create families for over 30 years, and we have been using the vitrification technique for egg freezing since 2007, and it is getting better and better every year. We provide a boutique feel here at GIVF. Every patient who walks through our doors has a dedicated primary team of a physician and a nurse to help them throughout their journey. The nurse will help take the patient through all of the phases of the diagnostic testing and through their treatment so that they know they can always count on somebody to be with them along the way. The nursing staff is here to help educate and support patients through every phase so that they are confident and comfortable before and during their treatment for the egg banking cycle.
GIVF offers personalized care. I know it sounds cliche, but it's true. The nurses take a very vested interest in each and every patient. We care about the outcome. We care about you.
Hello, I am Dr. Vasiliki Morayani, and I welcome you to the Genetics and IVF Institute. Over the next several minutes, we will be reviewing what personal egg banking is, who can benefit from it, and why. We will also review how personal egg banking works, what are the success rates, as well as some of the risks. So let's get started. Personal egg banking is a method of enhancing one's chances of pregnancy later in life when fertility rates are naturally lower. That is, maintaining your fertility potential where it is now and saving it for later. We do that by retrieving and freezing eggs now, and then later the eggs are thawed, fertilized to create the embryos, and transferred back in the uterus. Since the 1960s, our laboratories have been very successful at freezing sperm. Since the 1980s, we have been very good at freezing embryos. But freezing eggs has not been so easy. The key development for personal egg banking to become a mainstream medical procedure is the development of a new freezing technique called vitrification. With vitrification now being the standard of care for freezing, not only of eggs but also sperm and embryos, we are able to offer personal egg banking to all patients. Who is a candidate for personal egg banking? Some of the earliest work was done with newly diagnosed cancer patients. More recently, we have expanded egg banking to the egg donation program. Previously, egg donors and recipients had to be matched in a very time-consuming process. With egg freezing, it has definitely streamlined the process and allowed egg donation to proceed very quickly. We are now expanding egg banking to patients who are delaying childbearing for any number of reasons, including education needs, career involvement, and delayed marriage. The use of personal egg banking is in a way insurance to maximize the future fertility, but it's important to say that it's not a guarantee of pregnancy in the future. Why consider personal egg banking? From age 20 to your early 30s, pregnancy rates decline only very slowly, while the miscarriage rate remains relatively low. From the mid-30s to the early 40s, pregnancy rates decline more rapidly, and the risk of miscarriage doubles and even triples from your early to mid-40s. Personal egg banking is for anyone considering delaying childbearing into their mid-30s and beyond. How does a personal egg banking cycle work? Well, it's not very efficient to try and retrieve and freeze one egg at a time, so a patient undergoes an ovarian stimulation egg retrieval cycle in order to accomplish their goals. This is usually started with oral contraceptive pills or birth control pills for approximately 2 to 3 weeks, and upon discontinuing the birth control pills, the menstrual period begins, and this is the start of an ovarian stimulation cycle. For the next 10 days or so, the patient will take fertility medications, including the use of follicle-stimulating hormone or FSH, and the medicine antagonist that helps control the cycle and reduce the risk of complications. A final trigger shot is given, and then the egg retrieval follows, and the total process usually lasts less than 2 weeks. During the stimulation process, the ovaries are monitored with ultrasound so that we can see the development and the growth of the follicles within the ovaries. After the 10-day stimulation, the patient is then ready for the egg retrieval. That occurs in an outpatient setting and with IV sedation. Using a transvaginal ultrasound, a needle can be placed through the back of the vagina into each individual follicle, and the follicular fluid is then aspirated and passed to the laboratory. In the laboratory, the fluid can be examined under the microscope for the presence of the eggs or oocytes. This is a mature oocyte surrounded by the supporting granulosa cells. In the next step, the oocytes are placed on a cryotip, and then the oocyte cryopreservation process with vitrification is begun, and the eggs can be cryopreserved in our storage tanks for many years to come. What are the success rates with personal egg banking? Well, it depends on many factors. We have blood tests and ultrasounds to give some prognosis of the success rate, but the most critical factor is the age of the patient at the time that the eggs are retrieved. In addition, how many eggs are frozen clearly plays an important role in the success rates. With one personal egg banking cycle, we like to obtain between 10 and 15 eggs that are then frozen. Within the group of eggs that are frozen, we set up cohorts of 6 to 8 eggs that can then later be thawed, fertilized, and then attempted for pregnancy. Each cohort has a success rate largely dependent on the patient's age. What we have learned with success rates in egg freezing is that they mirror the success rates with fresh IVF cycles. What are some of the risks of personal egg banking? The number one risk we should always mention is a condition called ovarian hyperstimulation syndrome. In fresh IVF cycles, this occurs in about 1 to 2% of cycles. The ovaries become enlarged, fluid can build up in the abdomen, and sometimes you need procedures to help treat this after the retrieval. What we have found with personal egg banking and the use of our newer protocols is that the incidence of hyperstimulation syndrome is actually even lower than that, but we can never say zero. In addition, during the egg retrieval, there is the rare risk of infection, bleeding, torsion, or twisting of the ovaries, but fortunately, these risks are very, very low. Probably the most important thing to remember as far as risk is that this is not a guarantee that one will certainly get pregnant and deliver in the future. We are simply trying to maximize your current fertility potential for later use. Personal egg banking is an exciting new technology, and at the Genetics and IVF Institute, we have been at the center of developing and pioneering this new technique. We look forward to working and discussing with you all your reproductive options for the future.
The decision to freeze my eggs was simple for me, though I realized it's not the case for everyone. There are many variables that play into the decision, but mine was a quick and easy one. I was going through a divorce and already had one child, but wanted to keep my options open for future fertility. I didn't want my biological clock leading me to make decisions about dating that my brain and heart would disagree with. Freezing my eggs allowed me to date without the pressure of forcing a relationship to work when it was destined not to, or pushing a potential partner along more quickly than either of us would have been comfortable with. The injections were no big deal. The nursing staff really prepared me and helped me be more comfortable doing them myself. In turn, this gave me the ability to control an aspect of my life over which I was previously feeling powerless. I'm the type of person who is always looking for more information, and I felt that the staff accommodated my questions and concerns quickly, so I was an active participant in my treatment. I am so thankful I made the conscious choice to freeze my eggs. I realize it's not a guarantee, but it feels good to know I took some control back in my life and have them to use if I want in the future. It's my insurance policy, so I can decide what's really right for me moving forward.
Okay, so you've decided you want to go ahead and freeze your eggs. Here's what you can expect. The diagnostic testing involves a simple blood test and a transvaginal ultrasound to assess ovarian reserve. Using this information, the doctor is going to determine which medication protocol is going to yield the best outcome for the cycle. Once the diagnostic testing is complete, a short cycle of birth control pills will be taken to help aid in a better cohort or group of follicles being stimulated together. It will also help decrease the chance that there might be cysts left over that could interfere with the stimulation. And lastly, it can help synchronize the timing of the cycle. Prior to beginning the cycle, each patient will come in for an injection class in the office, and they will also have a pre-cycle appointment with their nurse to go through all the medicines so they are prepared before they come in to begin the cycle. Once you are ready to begin the medication, a baseline blood test and ultrasound is performed to make sure everything is quiet with the hormone levels and the ovaries so that you can begin the stimulation medicine. The stimulation medicine is taken for an average of 8 to 12 nights, during which you would be coming into the office about 5 or 6 times for monitoring visits. There is minimal interruption in daily life as we begin monitoring at 7 a.m. to help patients get in and out and on with their life. The retrieval process is completed in less time than it takes to get a pedicure. Patients arrive at the office an hour before the procedure to meet with a nurse for instructions and get their IV started. Then they meet with the physician to review the process again and answer all questions, as well as meeting with an anesthesiologist. The retrieval itself is completed in about 20 to 30 minutes. You are given light sedation, so you're breathing on your own, but you are comfortably sleeping and don't feel anything during the process. Once we're sure that you're feeling well, you're able to drink and go to the bathroom. We will let you head out of the office and home for the rest of the day. There must be a responsible adult present to drive you home after the procedure, as you cannot drive yourself once you've had anesthesia. Most women are fine to return to work the next day and most daily activities without overdoing it. You may feel some slight menstrual type cramping though, which is normal. Once the retrieval is complete, the eggs can be frozen for a minute, a month, a year, or indefinitely until you decide if and when you're ready to come back and use them.
What if I decide not to use the eggs?
If you decide not to use your eggs, they can be discarded or donated for research, and that's the benefit of freezing eggs instead of embryos. Women are not faced with the ethical dilemma of what to do with embryos if they decide not to use them.
How much will it cost?
Unfortunately, most insurance companies consider this an elective procedure. So because of that, we strive to keep our costs for treatment as low as possible. The financial counselors are available to talk about different loan options that are out there. The nursing staff will order the medications at the most cost-effective pharmacy to save as much money as possible, and often these pharmacies offer rebates to patients in these situations.
How will I be able to inject myself?
Through personalized care and special instructions from your nurse, you will be comfortable and confident before beginning any injectable medications. We will send online videos to watch, have you attend an injection training class with an instructor, and you will have a pre-cycle appointment with your nurse to review all of the medications and details before the cycle actually begins.
What symptoms will I feel?
Many women want to know if they're going to gain weight during the personal egg banking process. It is not uncommon to gain a few pounds during the treatment, but typically once it's completed, it goes away fairly quickly. Most women do not have mood swings with the medication used for personal egg banking and actually feel relieved and empowered as they've taken some control back on their future fertility.
The best kept secret is that the staff is like family. We help each other, we support each other, and that makes us a really good team.
We are there with you every step of the way through the testing and completion of the treatment.
When you come to GIVF, you feel like you're part of something bigger, something homier. When you come into the lobby, it's a welcoming feeling.
Honestly, the best kept secret is our incredible lab. Labs are the heart of infertility institutions, and we have among the best. You may not see them, they're always behind the scenes, but they're caring for you each and every day.
It's a very warm atmosphere. The patients usually leave feeling like they've have extended family here at GIVF.
Thank you so much for taking the tour of Genetics and IVF's personal egg banking program. We hope that you've learned enough information so you can make an informed decision on whether or not this process is right for you. There is no right or wrong decision about whether or not to freeze your eggs, as every woman's situation is unique. The best advice I can give is to make the decision that's going to leave you with the least amount of regret. Would you regret not banking your eggs if in the future you faced infertility? Or would you regret freezing your eggs if you decide not to use them in the future? No one can tell you the right answer for you, but it is important to make sure you're making an informed decision on your future fertility potential.
Life begins at GIVF.
Life begins at GIVF.
Life begins at GIVF.
Life begins at GIVF.